Today we're talking about emotional health and vasculitis. I'd like to welcome everyone to the Road to Wellness webinar series. Today we'll have a question and answer discussion about emotional impact of vasculitis. We'll talk a bit about depression, anxiety, stress, all the things that are part of the package that comes with a chronic illness such as vasculitis. And we'll share some personal and patient perspectives and insights about our experiences dealing with the impact of vasculitis. And today we'll end with some positive, powerful coping strategies. So I'd like to begin by introducing myself. I'm Kathy Olevsky, and I'm the 2020 host of the Road to Wellness webinar series that is through the Vasculitis Foundation. I'm a patient just like many of you, and I was diagnosed in 2008 with ANCA vasculitis, and I've been in remission for 7 years. I'd also like to introduce our two speakers today. And first we have Dana DeMolin. She's a licensed clinical social worker with Halcyon Hospice and Palliative Care in Denver, Colorado. She's worked in private practice and as a medical social worker for 30 years. We also have Dr. Sarah Amodio, who has experience as an educational administrator, an educational psychologist, and a private consultant for international non-governmental organizations. She holds her master's in social work from Stockholm University in Sweden and her doctorate in education from Regent University, where she specialized in assessment, programming, and evaluation, curriculum development. Sarah is also a patient who was diagnosed with EGPA in 2015. I think we should start off today with our questions, and I'm basically going to throw out a question or two that we've gotten from patients to you two, and you feel free to answer the best way that we can communicate the answers to our viewers. I'll start out by saying, do we know how getting a diagnosis of vasculitis can impact our emotional health? What changes happen like before diagnosis and after diagnosis in terms of stress and depression, anxiety? Dana, I think I'll throw that out to you to see if you can start us off.
Sure, thank you. I think the most important thing that happens is your homeostasis is disrupted when you get a diagnosis or when you're looking for a diagnosis. Your whole question of how's my life going to change within my family, with my work, how will the plan I've laid out for my life change now? How can I integrate this new aspect of my identity with the person that I know myself to be? Sarah, is that consistent with what you have experienced?
Yeah, absolutely. I mean, I think the big question that I had as a patient was, what does the future look like? And I think that was really difficult for me to wrap my brain around mentally, because here I was dealing with all these physical issues, but how this was all going to pan out 5 years from now, 10 years from now, that was a layer of stress that I just wasn't anticipating when I was first diagnosed. And I think no one knows. And I think it's that unknown that lends itself to a certain amount of anxiety and a certain amount of uncertainty. And it just, like you said, it throws everything out of whack. And your homeostasis is what you had before. What was working before is now not working. And you don't know if it's going to get any better, if it's going to remain the same. So yeah, all these different things are coming into play when you're first diagnosed.
Well, I can say as a patient that it's good to hear those things from you two experts, because this is exactly what happened when I got my diagnosis, so many years ago. It was such a rare disease, and I had absolutely nothing but anxiety at the time. Can you tell us a little bit about what the emotional impact is from vasculitis on like a family or a career, also as a parent or a spouse? How can we adjust to becoming more dependent and losing some of our reliance on everything due to this illness? Dana, you want to start?
Yeah, I think it's helpful to think about a chronic illness as a couple or a family problem. It affects everybody. The whole social system that you live within is affected. I think that it's important to make sure you are leveraging mental health help if the vasculitis diagnosis is beginning to color all of your family interactions. Everything is about vasculitis all the time, and that continues for months and months and months, because I mean that's very that's predictable in the first phases of an illness. But if you're not coping and you're not adapting, ask for help sooner rather than later, especially if your coping strategies are maladaptive, if there's alcohol abuse or physical violence or with emotional withdrawal.
Right, and I would definitely say that one of the things that that I learned very quickly is that, you know, you had the rules of the game with all these different family members and with your kids and with friends. All those rules changed on some level, you know, and so what maybe worked before, and the rules that you maybe had rules or, you know, kind of ways of interacting with certain individuals, they were kind of upended a little bit. And so there was a fair amount of renegotiating what those rules meant. And I think, Dana, to your last point there, the thing that I noticed, and I know my husband can kind of attest to this too, is like those weak links that are maybe in those relationships, or the things that maybe were, you know, kind of you forgot about or you kind of ignored, all of a sudden, boy, they become really hyper intensified when you're newly diagnosed and you're having to renegotiate what those new relationship rules look like. And so all the different things that, you know, maybe you were trying to ignore, all of a sudden, boy, they come bubbling up to the surface, and having to deal with those on my own, even for someone that I felt like, okay, well, I've got kind of a skill set to be able to handle this on my own. It was super helpful to have someone else to talk to when it came to these things, because getting that outsider perspective and getting someone else to kind of weigh in and fact check you and reality check you on some of these was helpful. And also engaging those other family members in that conversation was so incredibly valuable. I think we learned much more about how we were interacting. And I've always said that vasculitis was kind of a mixed blessing in some ways. It's like it brought to light all these different things that we needed to kind of focus on in our relationships. And once you kind of get past those and once you're working through them, there's a real potential for them to get better and to really kind of be more robust and rich in your relationship. So there is a hidden blessing in some of these kind of dynamic changes, for sure.
Well, it's great to hear that from you, Sarah. I'm hoping that some of the things that I went through as a patient were things that I can see them now, that they were things that aided my family in some new steps in their lives. But at the time, I definitely could not see it. I also did not seek help from anyone. I wasn't advised to do that, and I didn't think to do it. And I totally wish that I had done it. I hated some of the skills that I lost right away. I could not multitask to save my life, and I was a premier multitasker beforehand. Maybe some other patients will relate to that. And then raising my children, one was grown, but one was still at home, and that learning the new roles, like you said, that was really interesting. I learned that I had a great partner who took care of me. My husband was outstanding. And I didn't know that about him. I didn't know he was such a caregiver because I was the nurturer in the family. and I learned that I had a daughter who was 16 who could, grow herself up pretty quickly.
And Kathy, one thing that Sarah and I have talked about, and I wonder if it's true for you too, is that a diagnosis like vasculitis tends to make everything more and everything bigger. Little problems become big problems, and little issues become really troublesome. But also gifts and strengths and powerful things are also amplified. Has that been true for you?
Oh, yes. And some of the interesting things that I learned that I thought were just the most horrible things about my illness wound up being things that, like, I said stuff to my daughter about how she did everything to get herself into college by herself, including basically filling out that FAFSA.
Oh, yeah.
No.
Every parent can't stand having to do.
Right.
she did it at 16 and was just like standing behind me, patting me on the back, saying, "You can do this, Mom. It's okay." And I was like distraught, and I couldn't think, and I needed more time, and I started crying, and so we talked about that many years later, and she's like, "I don't even remember that." So the things that are the most difficult may not be affecting other people at all. It was very interesting to see the things that I thought were the things that I was failing in. But anyway, it turned her into a really assertive, strong, young female. So how could that be bad?
Right,
So,
right.
I also wanted to talk to you all, because this comes up all the time, about how our meds are affecting us. Like, are they responsible for the craziness of our emotional symptoms, or is it more just a response to the illness? You know, is there a way to lessen or control the impact from the meds? You know, steroids, chemo, all kinds of things. What do you think about that? Sarah, you want to start off on that?
Yeah, it was actually when I first was diagnosed, they immediately put me on prednisone. And, to start the process of stabilizing everything before they could put me on rituximab. And there was one question that I really wish I would have asked right from the get-go. I mean, after the nurse who called me up and said, hey, you're going to be on prednisone, and oh, by the way, make sure that you're really regular with it, and oh, by the way, you might be gaining weight. Always ask, how is this going to be affecting me mentally and psychologically? I have since learned, because I didn't with prednisone, and boy howdy, do I wish I would have, because it really did impact my mental state, and it impacted, how I was interacting with others and engaging with others. I had a really, really, really short fuse. And so that impacted my relationships with others and my ability to be more level-headed when I was reacting to some things. So yes, I mean, to answer your question, absolutely, that certain medications definitely impact you psychologically, and they impact your mental health. The other big one that I know that a lot of folks with peripheral neuropathy take is gabapentin. And that's another one for sure that I noticed, that impacted me psychologically when I didn't anticipate it, right? And it's so funny to me sometimes with some of the medications, when you look on GoodRx or some of those websites when they describe the medication, sometimes those psychological or those emotional reactions, those emotional side effects are kind of listed at the very bottom, but I would definitely check them out, because you never know. And people react to medications in different ways physically, but they also react to medications in different ways mentally and psychologically. So yes, and the fatigue element too. So it's not only just the mental health and maybe the chemo brain, or the inability to process cognitively, or being angry or weepy or any of those kind of things. The fatigue element and how that impacts you psychologically is a big thing too. So when you're super tired, you're really not thinking clearly. And if you're super tired and you're kind of in that weird cycle of not getting enough sleep or getting too much sleep, that impacts you psychologically as well. Mm-hmm. Dana, did you want to kind of tag team on that one?
Well, and it's just at the other end of the bell curve, if you are finding that you're having thoughts of self-harm or homicidal ideation, certainly make sure you are talking to your doctor about that, because there is such a thing as steroid psychosis, and I don't think people are aware that the emotional effects of these drugs can be really dramatic. A small percentage of the time, but certainly it does happen. So be aware of that and ask questions about it.
Sure. Yeah. And that was, Dana, just to kind of just briefly on that too, one of the things that I know people are really nervous to talk to their doctors about some of the psychological impacts that these medications have.
Yes.
Because they think, oh, is this all in my head? Is this really, am I really going through this? I mean, maybe this is me just overreacting. Mm-hmm. To always bring that up with your physician, because you never know. It might be that you need to dial back on it, or maybe there's a different medication, or maybe you need to stop it altogether. So it really does need to be part of that conversation with your physician for sure.
Absolutely.
That's really good to hear from both of you. I think I wanted to blame the medication for a lot of the things that was going on when I realized that those medications often do have some of the, I had a great doctor who told me those things too, though. So it helped me that it wasn't just me, but when I go in for a checkup, he'd say, oh no, it's not you. You will come back. This is prednisone.